Assalamu alaikum. I am Dr. Tamanna Rahman from Bashundhara Medical College. I am a lecturer from the Department of Pharmacology. Today I am going to discuss about the anti-anginal drugs. I choose these topics as it's an important to know, especially for the students of our third phase and now in case of second phase. So let's go to our topic, anti-anginal drugs. First, I would like to discuss what is angina. We all know that the angina pectoris is a chief symptom of ischemic heart disease that is characterized by sudden severe substernal discomfort or pain which may be radiated to left shoulder and along the flexor surface of left arm. And what's the types of angina? There are three types. We all know the classical angina, stable, which is also known as the stable angina, and unstable angina, and variant or prince-metal angina. What is classical angina? Classical angina is a pain that is induced by either exercise or emotion or both of increased myocardial oxygen demand. In such patient, there is narrowing in the coronary arteries due to arteriosclerosis, and therefore the coronaries cannot dilate to increase the blood supply during exercise. Now let's move to what is unstable angina. A combination factor like increased myocardial oxygen demand, coronary vasospasm, platelet aggregation may result in angina called unstable angina, which requires immediate treatment. And what is variant or prince-metal angina? Occurs at the base and is caused by spasm of coronary artery. Now let's move to the drugs that are used to as anti-anginal drugs. Our main target is to just improve the balance between the oxygen supply and demand, either increasing the oxygen supply to the myocardium or by reducing the oxygen demand. So, remembering this target, our drugs here. The drugs are used for as anti-anginal drugs. The classified as nitrates, beta blocker, calcium channel blocker, potassium channel opener, and other anti-anginal drugs. In case of nitrates, we use short-acting and long-acting. Short-acting is generally used as glyceryl trinitrate, and in case of long-acting, isosorbate. Isosorbate mononitrate, and dinitrate. There's others like calcium channel blockers like verapamil, diltiazem, and in case of beta blockers, propranolol, metoprolol. And potassium channel opener is also a new drugs which are used nowadays like nicorandil, and the other anti-anginal drugs like trimetazidine, ranolazine. Let's move to glyceryl trinitrate, as it's one of the most important drugs. Here the nitrates are used as a vasodilators. They converted to nitric oxide by the enzyme mitochondrial glutathione S transferase and aldehyde reductase. So what's the mechanism of action? How it works? The organic nitrates are converted to the nitric oxide, as I already mentioned it, by the enzyme. Then activated the glucuronide cyclic and cyclic GMP. These drugs are dephosphorylation of protein kinase and causes the reduce the free cytosystolic calcium, which relaxes the smooth muscle. So what is produced? What is pharmacological action? The pharmacological action is reduction in preload, reduction in the afterload, and coronary dilation. So what's the indication of our glyceryl trinitrate? The mainly used and especially used the angina pectoris, acute coronary syndrome, myocardial infarction, chronic heart failure, and acute left ventricular failure by biliary colic, esophageal spasm, cyanide poisoning. What's the adverse effects? Their adverse effects are really important because it's whenever I am going to administer this drug, The patient shows sometimes signs symptoms immediately. Sometimes it can go for 10 to 15 days. Some symptoms are reappear or appear day after day. So what's the adverse effects? The adverse effects are throbbing headache, postural hypotension, reflex tachycardia, tolerance. Here are the two types: the true tolerance and pseudo tolerance. What we mean by the true tolerance? Due to functional deficiency of glutathione S transferase, this causes true tolerance, while the pseudo tolerance is due to reflex tachycardia. Now, what's the contraindications? The contraindication is raised intracranial pressure, pregnancy, obstructive cardiomyopathy, heart block, diastolic failure, hypersensitivity, and cerebral hemorrhage. What's the preparation? We can find the preparation are generally available as oral, sublingual, parenteral, and ointment. We generally use the sublingual form mostly, as its action is rapidly at that time, and we need to use sublingual for the rapid action. Yes, I want to discuss about a special term which is known as a Monday morning disease. What do we mean by Monday morning disease? Actually, the workers from the nitrous explosive manufacturers, they exposed to the nitrates every day. For this reason, first when they join their company or the workshop, they feel this headache, weakness, and flashing and palpitation. But during the vacation or the holiday, they are not contact with the nitric oxide. So when they return their work at Monday, they again face these symptoms like flashing, palpitation, headache. As it occurs at the morning of the Monday, that's why it's also known as Monday morning disease or sickness. Here's also the other drugs we already discussed, that one of them is beta blockers. We also generally now this is used. You all already I mentioned it. So that's all now for the anti-anginal drug. I would like to mention it again that the drug, which one is most important? The GTN, which is known as glycyrrhizine nitrate. So student, you should focus about its mechanism of action, especially the adverse effect and its contraindication. That's all for today.